So again, policy and advocacy the next decade. I really believe, and Peter Brooks was talking about it, but the utilisation of online mechanisms, getting involved in all these newer technologies, we need to embrace that with policy and advocacy and education and awareness. And social networking and marketing, country coalitions like the US BJD making unique collaborations, and changing and regeneration of ideas and programs. Now, probably today we've all heard talk of various things that people talked about 10 years ago here in Lund when the BJD started. And that's not a terrible thing, but we have to look at, okay, that's a good idea, it's been around for 10 years. Do we need to change it a little bit? Do we need to tweak it to drive it forward? And I just want to mention here osteoporosis and fracture liaison service, because in terms of policy development, what we want governments to do and for treatment for people with osteoporosis, the idea of this fracture liaison service is something that we are really excited about and really want to push. And Christina Ackerson and Dave Marsh are the leaders of that, if you like, for the IOF with our fracture working group of our Committee of Scientific Advisors. So while we'd like to prevent all fractures, we know that's never going to happen. But if we could capture everyone who's had their first osteoporotic fracture and see them treated and managed appropriately, not just with medication, even if they're diagnosed, that would be a major plus. That they're given proper exercise advice, that they have nutritional advice. And we know from the research that the best way to do that is to have someone, a person, a body, following up people as the fracture liaison service coordinator, nurse coordinator, fracture coordinator, whatever you want to call them. So we have the evidence for that, and our position paper on that will be coming out very soon. And if we did nothing else, as I said, we could probably hold our heads high if we could see that implemented in a certain number of countries around the world. It already is existing in many countries. It's just not formalised as a government-supported program in many areas. So just new technologies, obviously, Facebook, Twitter, YouTube, all societies, all of us have to be involved in these in terms of policy, advocacy, and education. We have to be there. And I just, as a last thing, want to mention IOF has a new grassroots program called OsteoLink, which is an online program. It's interactive, it's online, it's being launched in certain countries now, including Sweden in the next few months. And it's about getting people talking online, patients, carers, doctors, families, an online platform. It will involve some physical in-person meetings down the track, but what's new about it, I guess, is that it's a grassroots online program creating in-person and online communities and networks. And that's just giving you a pictorial look at OsteoLink and just involving everyone. So challenges for the next decade, some more words in bold: strategize, collaborate, create. We need to create a greater movement. The bone and joint decade has been fabulous, but now it needs to move on. It needs to be bigger and bigger. We need to define common approaches to chronic disease management. And I'm sure tomorrow when Shanti Mendez will talk about the chronic disease World Health Organization approach, we can't anymore, well, in many cases, talk about just osteoporosis or arthritis or spinal care or trauma. We have to talk about it under chronic disease management approach. Enhancing patient power, and we've heard a lot about that today, and involving all the stakeholders. So I think I've said all this, but again, promoting chronic disease strategy with a focus on prevention and lifestyle choices. I think we can do that more easily in osteoporosis than we can perhaps in arthritis, but we have to be aware of that. So that's it, Amy.
Thank you.